Since then, more and more hospitals have been bought up by larger hospital systems. The two main systems in Connecticut have been the Hartford HealthCare system and the Yale New Haven Health System. And Hartford HealthCare acquired Windham Hospital within, since the year 2000, probably I would say about a little more than 10 years ago. What we have found in this work across the state is this consolidation in hospitals has had an impact on access to care and the cost of care, actually driving up the cost of care. And many studies, independent studies, have shown that this has not resulted in any meaningful impact on the quality, improvement in the quality of care. So we're very concerned about this issue at Universal Healthcare Foundation because we have seen over the past couple of decades an erosion of the concept of community in hospitals as they have been swallowed into larger chains. It becomes more of a corporate, centrally located entity that decides what they want to have happen in the different hospitals in their network. Like many hospitals, this is an issue that Windham Hospital is dealing with. The first big sign of trouble for us here in the Windham area was in 2016, when Hartford HealthCare decided to close down the intensive care unit. That has had a ripple effect on medical practices, particularly OB/GYNs in this area, which we will unpack for you in this conversation today, because there's a lot more to that we hope to have people understand. I also want to point out that in 2016, a coalition of hundreds of area residents got together to protest the potential closure of the intensive care unit. Disappointingly, the state's regulatory entity let it happen. And we believe that this has led to the situation that we're in today. Fast forward to 2020, Hartford HealthCare determines that not enough births are happening at Windham Hospital, and it's better to send mothers to two of their other hospitals, one in Hartford and one in Norwich, via ambulance or in their own vehicles on winding secondary roads with at least a 25 to 40-minute drive if they don't run into any problems. This is a situation they had that we believe Hartford HealthCare had a large part in manufacturing going back to 2016, and likely in decisions that were made before that. In the coming months, we expect the state regulatory entity, the Office of Health Strategy, to hold a hearing called a Certificate of Need hearing. The regulators will make a decision and determine whether Hartford HealthCare will be allowed to permanently discontinue labor and delivery services at Windham Hospital, or the regulators could require a plan for restoration or mitigation somehow. Our goal is to have a conversation about this today and bring you all in on what's going on here in Windham and sort of set up a red flag, send up a red flag for what could be happening in other parts of the state. It may not be labor and delivery. It may be other things. So later in the meeting, we'll post how you can sign the petition that we have and get more info on how to help make a difference in this fight. Particularly, we are looking for organizations and individuals that would like to weigh in with us when this issue comes up before the Certificate of Need hearing. So I'm going to open it up to conversation with Arvind and Leah. Leah, I want to ask you the first question. why is this issue important to the NAACP chapter here in this region? Why do you spend so much of your time and use your voice to stand up on this issue?
Well, as you know, Lynn, well, hello, first of all, Lynn and Arvind as well, and the community. But as you know, the NAACP is the civil rights organization, and our job is to fight to protect those civil rights. And we feel that quality health care falls under that umbrella of civil rights. And in terms of labor and delivery, I mean, what more can a woman ask for but a safe place to deliver a baby, to continue on in the development of their family? So in terms of why I spend my time on this coalition, is because I want to make sure that the rights of our community, childbearing, women of childbearing age, have the right to safe, close to home, quality labor and delivery services.
What do you think about this, Leah, as an issue of equity? What is it about the demographics in this area that make it even more important?
Well, we all know that in this northeast corner, we do have a segment of our community that struggles economically. Our Black and Brown community are really affected by this decision in terms of lack of transportation, lack of support from family if they're having to deliver out of the community. And we're very concerned that this is affecting us overall.
Yeah, thanks. So Arvind, I'm going to pass it over to you, and I'll come back to you, Leah, of course. And feel free to jump in as this evolves, because we could have a three-way conversation. It doesn't have to just be me.
Sure.
Fielding, pitching the questions. But Arvind, I'd like to ask you to describe for the people, because we have people who will be watching this from around the state who may not be familiar with what's been going on. And I think it's pretty confusing for people when they hear one thing from the hospital saying, well, we have too few deliveries of babies to have a feasible, viable labor and delivery program. But there were things that have happened over the past decade that led us to this place. And as the CEO of the local community health center, you have some history with this. And I'd be interested in hearing you, briefly describe to people how we got to this place.
So, Lynn, first, let me thank you. Thank you for your leadership, and thank you so much to the Universal Health Foundation for amplifying our voices and joining with us to make sure that this equity is not just notional, it's actually active. We all talk about disparities in healthcare and social determinants of healthcare. I look at this as the institutional determinant of healthcare, where institutions actually determine what kind of healthcare is being or is not being provided. And I see this as very specific to not just women of childbearing years, all women of childbearing years. I see this as very specific also to the latest in our community, the newborn babies. There's always a pride of knowing where you were born. I think that's a really important part of this. For 88 years, this hospital has somehow maintained this public access, has maintained this public benefit, and hasn't shied away from this. And this cost avoidance strategy, if it is a cost avoidance strategy, seems like it's basically thrown all these things to the wind and said, there's too much risk over here, we're backing out of this. And when you have a large institution like a hospital do stuff like this, it really makes you wonder, so where is the safety net? Why is it being removed from here? In all studies that we've seen that it leads to a cascading of effects that happens to other aspects of folks as they access the healthcare system. In our region, we've got transportation issues, and these transportation issues are very specific to how do you get a patient from uh, their home to a visit or back. And we've seen a deterioration of the system for years now. It was, it was there. It has been there from the inception. That's part of the nature of our rural care. And this what tells us that, we need to have distribution of care. We need to have, excellence in primary care, in our safety net, if we want to see that things are going to get better. When Hartford HealthCare approached Windham Hospital and made this pitch to Windham Hospital and convinced the board, they basically said that, look, you guys don't have a chance of surviving unless you join with a larger. And we will invest in this community. We will protect your jobs. We will make sure that all these things remain intact. And yes, as we go through this thing, we will keep the community involved. And so we went along with that. In 2011, I was approached by the CEO and of Windham Hospital. He asked me at that point, he says, look, we're having a tough time with maternity and delivery. Could you help us with this? And so we created a kind of a collaboration where they would be responsible for the workforce, and we would be responsible for the running of it. And we organized this. They never came close to even executing it because they had a very solid arrangement with a local provider, a quality local provider.
When you say a local provider, you're talking about a local OBGYN practice.
Yes, a local OBGYN.
Yes, yeah, yeah.
And this local OBGYN practice was very well equipped to provide those services. And so they didn't ask us to go forward. In 2015, they started diluting the services over there, and they started saying, hey, you know what, we can't run an ICU. We want to make it a PCU. And we said, this is a termination of services. And we argued about this. And the certificate of need process basically determined that this was not a termination. And it was basically, services were still there at the hospital, but they were in a different form. And there was nothing we could do about that. We couldn't object to that any further. The hospital promised us at that time that, look, there were some cornerstones in this community that weren't going to be touched. One of the cornerstones was women's health. And you can see it in their literature. It's a promise. They promised this as a community benefit. Now, all of a sudden, and they've got very selective memory about these things. The promises that were made by the previous CEOs are forgotten by the next CEO. And they've had so many of them that, it's been difficult for us to really maintain any continuity with the leadership at Hartford. And they've been very difficult to communicate with and to explain to them, like, look, you shouldn't be doing this to the community. There's a better way of going about this. I begged them. I told them, look, take your time if you have to do this, but make sure that the community weighs in on this, because there's some very strong feelings about this, and you need to be appreciative of those feelings.
Right. I'm going to interject here. Yeah. Do you want to wrap up your thought? I'm sorry.
All I'm saying is that there's a long history with women's health and Windham Hospital. Unfortunately, now I think it's being looked as a risk avoidance strategy, as a cost avoidance strategy, and I understand that. Every entity needs to pay attention to risks and costs, but I don't think that you should do this without the benefit of a community conversation, of an open way of being able to discuss this. And so, we find ourselves that here we are, at the end of August. We've already been we've been 17 months now without continuous services over here. And so many children and so many women have had to go elsewhere for their care.
Right. I'm going to jump in here, Arvind. Thank you for that. One of the issues that's out there right now in this conversation is, Hartford HealthCare's contention that everybody's going to be taken care of, that nobody's going to be left behind, that transportation will be provided for people. There already has been one death related to ambulance transportation between Windham and Norwich. There are stories of women who have had to give birth en route.
Yes.
And there are stories of people being transported by helicopters from Windham Hospital to Hartford if necessary. Leah, is there anything you want to say about what you've heard from people in the community about the inability to access labor and delivery services at Windham Hospital and what that has meant for real everyday people?
Well, the stories we've heard, they've been really heartbreaking stories, Lynn. First of all, our community was not aware that this was happening. I happened to pick up the Chronicle one day and I saw the article in the paper.
Mm-hmm.
Not everyone purchases the Chronicle. Not
everybody goes to the Hartford HealthCare website or the Windham Hospital
Nobody
website.
goes to the website. There wasn't an entity in place to have this educational forum for our community and a back and forth conversation with the administration of Hartford HealthCare about our community. And when we started the conversation with them, Arvind and I and our state representative, Susan Johnson, we started the conversation with them. We really felt as though they had no intentions of communicating with us, and that the few people they spoke to in the community certainly weren't women, and they certainly weren't women of color, and they certainly weren't people who were going to be affected personally by this decision. So our immediate response was, why didn't you talk to us? Why didn't you engage our community? This was a community hospital. This is our hospital. We take ownership of this place. That hospital has saved my life thousands of times, and for me, not knowing what's happening in that hospital, I thought was a slap in the face.
Yeah, go ahead.
Yeah,
Go ahead.
so that's my answer, is that there wasn't any communication. And the community, when we began to educate the community, not only women, but men as well, were appalled. And the first thing they said to us is, where do I sign on the dotted line?
Mm-hmm.
You have a petition, can I sign it? When can I testify?
Mm-hmm.
When can I show up, Leah? Because
That's
my first thought, Lynn, was, straight protest right in front of the hospital, shut them down till they give us what we want. That's not always the best method, and there is a procedure of which we are all going through now.
Well, Leah, that's a good point about you sort of amplified what Arvind had raised, which is the lack of robust, meaningful community dialogue with the hospital. The hospital, of course, has said they had, they went to the town officials and they talked to them about this. That's different than having like a hearing or a community conversation or involving people in the decision making.
Exactly.
And I think that that's one place where they really tripped up.
Yeah.
Go ahead.
The other part of their conversation, and Arvind can, solidify this, but the other part of the conversation was about the risk, and which of course we all can appreciate, because we don't want you to haphazardly deliver babies. We want you to deliver babies in an appropriate, safe manner. And we want you to have the equipment and the staff to carry out that mission. And, you know, Arvind can pick it up from there because no neonatal unit, no this, no that.
Well, we have said as a community in the Windham United to Save Our Healthcare, we have said that we would be happy to work with the hospital to figure out a plan for how to reinstate labor and delivery services at the hospital. There are certainly plenty of rural hospitals around the country that have struggled with whether or not they can get the OBGYN practices in their area to support labor and delivery services. I was at a certificate of need hearing that Hartford HealthCare had when they took over Torrington Hospital up in the northwest corner of the state. And at that hearing, one of the arguments that they made is by joining a larger network, we can help ensure that there will be the staff that is needed in the specialty areas that are needed to maintain the services that are needed. And so there seems to be a disconnect between that kind of statement and how they've approached labor and delivery.
Absolutely.
Arvind, I want to throw it back to you for a second. Can you talk a little bit about the comorbidities and the sort of health needs that there are in this area of the state that are unique and need more investment in community hospitals and care?
Absolutely. So, it's very clear that Windham Hospital is ranked last. Sorry, Windham, the county of Windham is ranked last in the state when you look at mortality, when you look at asthma, when you take a look at every basic factor that is measured in public health. And it's a well accepted fact in the country that rural healthcare is sparse, and there is a lot of scrutiny which has come on these closures, especially closures of maternal health. And improving maternal infant health recently has become a priority for both the US Department of Health and Human Services and CMS. And in 2020, so this is just last year, there was a policy brief to Health and Human Services. The National Advisory Committee on Rural Health and Human Services stated that the impact of loss of accessible obstetric services and increased distance to travel to care, and this is a direct quote, has been associated with increased risk of non-indicated induced cesarean section, which can lead to more complications, postpartum hemorrhage, prolonged hospital stay, and postpartum depression. Similarly, in 2019, which is a year before, CMS explained the lack of access to high quality, and Leah, that's what you're talking about, quality care. Lack of access to quality care, maternal infant health services in rural communities can result in a number of negative maternal health outcomes, including premature birth, low birth weight babies, maternal mortality, severe maternal morbidity, and increased risk of postpartum depression. So, I mean, here you're hearing it from both sides that, look, this is a bad idea.
Yeah.
So I just want to piggyback on one more thing, if I can just, because,
Sure. And then I want to move us on to wrapping up because we have 5 minutes left.
There are resources that are available in the community. And when I went to Kimball, and I spoke with the leadership over there.
Folks may not know who are watching this. Kimball is the hospital in the far northeast corner of the state. Go ahead.
I went also. I spoke with the folks at UConn. Because they have got they've got several training programs, physicians. I said, look, do you have any capacity? Could you manage coverage? Could you help with this? They told me that they weren't even approached, which is such a such a callous oversight, in my opinion.
Yeah, so we've established a lot of things in this conversation, and I know people's time is valuable and we only have a few minutes left. So what I'd like to do is I'm going to send it back to you, Leah and Arvind, and in a second, I'm going to ask you to say to the people, tell the people who are watching this and who watch it after today on Facebook, why they should get involved if they live in another part of the state, what they can do to make a difference. We do want people to go to the Universal Healthcare Foundation Facebook page and share this and watch it again. We do want people to sign the petition. If you sign the petition, we will be following up with you with more information about what you can do and when this hearing is going to be and how you can weigh in. But I want to pass it back to you, Arvind, and then you, Leah, and very quickly to tell people why you think it would make a difference if they did something about this. Arvind?
So, the safety net needs to be funded and needs to be supported. There is no substitute for this. This is a decision that affects every family. And that's why I think you should be very interested in this, because it's just a matter of, somebody you love, their water bursts and their water breaks, and you're going to have a situation where they're going to be delivering precipitously. And that's why you do need to have local access. You don't need to be waiting in an ambulance or waiting for your ride or trying to get to where you need to go when you've got this important change happening, when you're when you're welcoming a new life in this world. Thank you.
Thank you, Arvind. Leah, what would you say to folks?
Well, earlier, Lynn, you said that this was happening all over the place, where these local community hospitals are being, taken over by corporations. And I would say get involved because it might happen in your community. And you will have, the knowledge and the experience and the voice to stand up for the rights of the people in your community. And that's what we're doing. We're standing up for our community. We are not going to just continue to allow them to continue to deplete and take away and leave us without the necessary healthcare services that our community needs. So we encourage you to get involved with us so that if it happens in your community, we would be willing to support you as well.
Well put, both of you. So with that, I'm going to wrap up. I want to thank Arvind Shah, the CEO of Generations Family Health Center, and Leah Ralls, the president of the Greater Windham NAACP chapter, and my partners in this coalition, Windham United to Save Our Healthcare. You can check that group out on its Facebook page, and you can also go to the Universal Healthcare Foundation of Connecticut's Facebook page. Please watch and share this with your friends. Encourage people who care about quality, affordable health care for all people in the state, not just those who can afford it, or not just those who can drive. We need to protect the quality of health for everybody. And we're thankful that all of you were here with us today, and any of you who watch this in the future. Thank you very much, and we hope you'll take action. Have a good day.
Have a good day.
Thank you. Thank you.